I'm doing a project for my Healthcare Economics 2011 spring. I'm coming up with a new concept for this class, and it's going to be a patient-centered healthcare reduction specialist. In my Healthcare Economics class, I'm challenged to come up with the concept to improve the healthcare system. When looking at the hospital as a whole, patient education and adherence to medication is less than optimal. A position needs to be created to educate and reduce recurring chronic conditions and hospitalizations. This position is an expert in the disease state, available products, and access to the products along with patient assistant programs. This specialist will be non-biased with all pharmaceutical programs and patient assistant programs. To give an example of how this would be cost containment for the patient and the hospital, I have today a representative from the medical industry.
It is. It's so true, Cody. So often do we see in the hospital setting, say an asthma patient comes in and they exacerbate. And this patient comes in and they're treated, and an average stay for this patient is 5 to 7 days. Most of the HMOs, such as Medicaid, even a Medicare, only pays for 3 days of these visits. So the hospital eats the cost for the rest of this patient's stay. Not to mention, without the appropriate education to this patient for adherence to their medications, or getting the medications at a cost that the patient can afford and stay compliant on, the patient can sometimes have another exacerbation and re-enter the hospital within a 30-day window. If this happens, the hospital actually will eat the complete stay for that patient in that 30-day window. As you can see, for a patient to be educated and able to stay compliant on these meds, not only is it a win for the patient to stay controlled for their disease, but the hospital to not eat the cost of that patient's stay.
The hospital would benefit from these programs by saving the money, and then the patients would be educated for their adherence, and that would allow them to be offered the assistant programs that are through multiple drug companies, as well as the Montel Williams program. There are public and private programs that benefit every type of consumers, the insured and the underinsured.